we are going to see how the infection is going to reach your brain. The infection will reach your brain from another infected part of your body via bloodstream. It also travels from your infected sinus or inner ear through the bones of your skull. Okay, now what are the conditions or factors which are going to enhance this process? Well, this process is enhanced by a weakened immune system, prolonged hospitalization, or by chronic renal failure. Now we are going to see about the most common symptoms of meningitis. These include fever, headache, stiff neck, nausea and vomiting, joint aches or pain, drowsiness, and seizures. There are some symptoms which are most common in children. These symptoms include fever, high-pitched cry, pale blotchy skin color, not wanting to eat, vomiting, fretful and fussy, arching back, difficult to wake. These are the symptoms which are most commonly that occur in children. So there are basically three methods to determine whether you have meningitis or not. These three methods include lumbar puncture test, blood test, and CT scan. Now we'll see one by one in detail. In lumbar puncture test, a special needle is placed in your lower back into the spinal cord. By doing so, you can measure the pressure of CSF in your brain and spinal cord, and a small amount of the CSF can be collected and can be sent to laboratories for diagnosing whether you have meningitis or not. The second is by, as I have said earlier, through blood test. Now in CT scan, you use a combination of X-rays and other computer technologies to produce horizontal and axial images of your body. Now, I am going to tell you about an interesting test which is used for diagnosing meningitis and septicemia. This test is known as the glass tumbler test. In this test, a glass tumbler is pressed against a person's rash, and we are going to see whether if the rash disappears under the pressure or not. So if the rash does not disappear under pressure, then it is a sign of meningitis.